Good afternoon. Welcome to day 268 at the EMA office, joined with Chairman Mark Kern and Barb Holt from the Health Department, where we bring you the latest in the numbers. Barb?
All righty. Good afternoon, everyone. Lots to report on today. Day 268, St. Clair County totals. We have tested 168,565. That's an increase of 1,437, and of those, 203 are positive. Those include males and females under 10 to 80 years of age. That makes our St. Clair County daily positivity rate of 14.1%. Therefore, we have a total of 16,430 positive cases in St. Clair County and 152,135 negative. Our deaths still remain extremely high at 263. Fortunately, we have no further deaths to report today. We have 13,595 persons that have completed the 10-day isolation period in St. Clair County. Statewide, we have tested 11,101,214, and of those, 787,573 are positive. That's an increase for the state for one day of 7,598. The death rate in the state of Illinois is 13,255. That makes an increase of 76 deaths in the state of Illinois due to COVID-related illness in the last 24 hours. Again, our thoughts and prayers go out to all those family and friends of those that have died in relationship to this pandemic, COVID pandemic. Hospitalization numbers in St. Clair County. We have 102 patients in St. Clair County hospitals, and of those, 8 are on ventilators. Region-wide, we're still above 200. 217 patients region-wide are in the hospital due to COVID-related illness, and 24 of them are on ventilators. On congregate care centers and long-term care centers, I'll just report on new cases. We have one additional case at Brea and Belleville, for a total of 75 cases and 8 deaths. We have 2 additional cases at the Mercy Rehab and Care Center in Swansea for a total of 33 cases and no deaths. And finally, at St. Paul's Home, we have 3 additional cases for a total of 87 cases and 67 deaths. As far as testing, 16 deaths. My apologies. Let me repeat that. At St. Paul's Home, 87 cases and 16 deaths. As far as testing this week, again, 7 days a week, 8 to 4, 7 days a week, we have testing at the mall behind Dillard's and Firestone in that area. This Tuesday and Wednesday, we will have a community testing center at McKendree University. And then next Sunday on the 13th, we'll have another community center testing site at the New Hope Life Church on Troy O'Fallon Road. And with that, I will turn it over to Chairman Kern, sir.
Thanks, Barb. Let's move into the zip codes. These are the COVID positive changes in these St. Clair County zip codes. In 62201, we're up 2 to 403. 62203, we're also up 2 to 412. 62205, up 1 to 407. 62206, up 9 to 814. 62207, up 1 to 402. 62208, up 10 to 929. 62220, up 14 to 1,113. 62221, up 26 to 1,534. 62223, up 8 to 995, 62225 up 4 to 82, 62226 up 29 to 1,759, or 1,752. 62232 is up 19 to 552. 62239 up 4 to 242. 62240 up 2 to 81. 62243 up 7 to 350. 62254 up 6 to 526. 62255 up 1 to 40. 62258 up 8 to 616. 62260 up 9 to 385. 62264 up 3 to 196. 62269 up 26 to 1690. 62282 up 2 to 42. 62285 up 4 to 323. And 62289 up 2 to 23. We had 1,437 people tested. Out of those, 203 new positives. That brings our daily county positivity to 14.1%. That also then brings our county 7-day rolling average to 14.4%. The state has us pegged with our regional positivity up today to 15.3%. Bond County rolls in at 11%. Clinton County at 12.6%. Madison County at 15.8%. Monroe County at 11.7%. Randolph County at 19.1%. St. Clair 15.5%. And Washington County at 19.1%. Herb, numbers are still not looking good.
Nope, the regional positivity went up from 14.4 to 15.3, and that's the one we got to watch. And then our cases, 203 new ones, and out of that, 104 of those were under the age of 40. So again, we keep preaching that it's every age range, all the zip codes. So it's definitely still there. Today's our question and answer session. Randy Randolph will be giving the questions out today. Thank you.
Thank you. We'll start with Barb. Director Holt, the first question came in for you is first a statement. Thank you for all your hard work for taking our questions and helping keep us informed. Number one, does IDPH check that schools are following the guidelines that you have asked them to follow? For example, the number of students in a classroom and if they are eating at school. Are they 6 feet apart when their masks are off? And then two, second part of the question is there a threshold for the positivity number before you will recommend schools go fully remote in St. Clair County as you did in the fall? Even if we are not seeing outbreaks related to schools, it seems that just the contact tracing and checking into class cases could be cut down by having schools go fully remote.
Yes, thank you. There are a lot of good questions in there. And again, as far as following up on schools specifically to ensure they're meeting the guidelines, we work with the schools every day. We consult with the schools every day for isolation and quarantine questions, for questions they may have to help them try to keep the children as safe as possible. I know they work with State Board of Education as well as the Regional Office of Education to follow all the guidelines as best as they can to keep the children safe. As far as a threshold for positivity rates, specifically, again, there's guidelines and recommendations, but each school is different, each situation is different, each classroom size is different. So the regulatory authority and to determine whether or not they go remote is up to the superintendent and school board for that specific district. And as far as contact tracing to have school remote, I mean, it's a tough question. One of the things actually is sometimes it makes it easier if the students are in school, we know that's one place they've been. They haven't been 3 or 4 or 5 different places throughout the day that they possibly could have been in contact with someone. As long as a lot of the schools, their policy is to wear masks at all times. They only take them off to eat during lunch. So again, with students being in school, trying to meet all the guidelines, our contact tracing, yes, we work very closely with the schools and we're very busy with that. But again, with the schools' cooperation, I think we're doing a good job of maintaining isolation and quarantine with anything related to the schools.
Okay, thank you. The second question, or the next question that came in is, my name and private information was given to the county as part of a contact tracing because of a possible exposure, along with several others. No one ever contacted us during our 14 days. What happens to our private information? My husband, who deals with IT security, was livid that our information was so freely given. Can you ensure the information is safe?
I can give you our training for our staff, we are under the guidelines of HIPAA, that we have strenuous training, ongoing security with our computer systems of all our information. According to HIPAA guidelines, only the people that have absolute need to know even have access to those computer systems, let alone other information within those computer systems for those individuals. I apologize as a contact to a case. You weren't contacted directly within the last 14 days, as everyone across the state has been very, very busy trying to keep up, and our priority has been getting in contact with the cases to make sure that they are isolated. So again, we follow HIPAA guidelines to the T, and we work ever so hard to make sure that our systems are secure, and we follow all HIPAA guidelines to protect your personal information.
Very good, thank you. The next person wrote in, I submitted a question last week about my employer not requiring masks and requiring we attend work even when the health department told us to quarantine. They have since started requiring masks. If you called them like I asked, thank you. Can you explain more about essential workers testing out of quarantine?
Again, the definition of essential workers are those that are required: medical providers, first responders, people who work in the grocery stores, those that have anything to do with health, life safety, food, water, sanitation, those types of things. So there's a long list of those that are essential workers. And again, isolation and quarantine, not only for essential workers, but anybody in general, really is based upon your particular situation and where you have been 48 hours prior to either your testing or your symptoms started, and the same for those contacts. So each situation is different for essential workers. Again, there are certain situations that essential workers that are quarantined and test negative may return to work. But again, each of those is handled on an individual basis.
Okay, very good. Thank you so much. The next question is the 6-foot social distancing requirement going to be changed to 3 feet?
No, not at all. CDC, IDPH, the recommendation is still absolutely 6 feet away.
Very good. The next question is, are people who have recovered from COVID going to be given the same immunity status for travel, etc., as those who get vaccinated?
Again, there is evidence and research that shows those that have had COVID have some immunity. This is an ongoing, we're still learning more about this disease and the immunity once you've had COVID. So at this point in time, the travel status, again, it's everywhere. In the United States and worldwide, it's everywhere. So everyone needs to follow the 3 Ws and stay safe and stay close to home. But at this point in time, they're saying that the immunity lasts for about 3 months once you've had COVID.
Okay, thank you, Director. Next question says, what type of COVID test is being done at these community testing events? Are they rapid antigen tests or PCR tests? Do they give the rapid antigen test for those who have symptoms and the PCR for those who don't have symptoms? If they are doing PCR tests, what is the cycle threshold used?
The community events, such as the ones provided by Southern Illinois Healthcare Foundation, what we had at the fairgrounds on Friday, what we'll have at McKinder University, as well as the 7-day-a-week one at the mall, those are all PCR tests. Again, the cycle threshold that is used for those PCR tests, I'm not familiar with that. I'm not a lab expert specifically, but I can say those are PCR tests, not the rapid antigen test. The rapid antigen test are offered at several different facilities. For the rapid test, those are antigen, but those are PCR at our community events.
Very good, thank you. Speaking of community testing events, I went to the fairgrounds to be tested about 3 weeks ago. I received a call telling me I was negative. Do they send you a copy of your results? Thank you.
If you would like a copy of your results, you can just call the health department. We'll call you as we did, we called you with the test results, and we're going through several of them. So if you need a copy of them, please give us a call, 825-4434, and we can give you your information that way per your request.
Okay, thank you. Obviously, a hot topic right now is vaccination. So the next person asks, what is the detailed plan to get people of St. Clair County a vaccine? Also, what is the plan to assess the mitigation since a vaccine was a condition of these being in place?
The general outline for the plan is located on the IDPH website under COVID. St. Clair County, EMA, our hospitals, we all have a plan internally of who, what, where, and when. Obviously, some of that information we keep to ourselves just for safety and security protocols to ensure that we keep the vaccine in a safe place, transport it safely. Obviously, this is a very precious material, so we want to ensure it's secure and safe. But we have plans. We work on these every day. Things have changed. We hope by the end, before the end of December, we'll have vaccine in our medical providers and long-term care residents.
Very good. Thank you. Next question asks, now that a few restaurants are closed, how long are they closed for and when will they reopen? Does the clock start over per se, or if a complaint comes in and the question was, if the complaint comes in, do we shut them down again?
Our policy at the health department that we're using for our complaints for COVID-specific related violations of the governor's mitigation orders, the first time we get a complaint, we call the facility and make sure that they understand what the rules are. Second time we get a complaint, we are on site either ourselves or through the sheriff's department, and we issue them a violation notice, specifically a written notice saying what the violations are. Third complaint, we do the same. They actually get a written report as a violation notice, and then the fourth time we'll issue another notice. After that, as we have done Friday afternoon, we have issued several food permit suspension orders to several facilities that have continuously violated the governor's mitigation orders. I know we have several others that continue to operate and will follow the same policy and procedures and guidelines for those individuals as well. As far as those that are closed, they have a right to a hearing per the policy and per the county ordinance. And for them to reopen, they need to follow the rules that the governor and the state of Illinois has set forth to follow those mitigation orders, and they can reopen at that point.
Okay, thank you. The next person asked, some members of our family have tested positive for COVID-19. We are told they will have antibodies in their system for 2 to 3 months. During this time frame, can or do they carry the virus and possibly infect other people?
It is possible, even though you may have your own immunity. But again, this virus is very, it's easy to distribute to other folks. I mean, just following the 3 W's, washing your hands, keeping your distance, wearing your mask. Those things still need to be in place because you can transmit the virus from you can be the transmitter and give it to someone else. You yourself may not get sick, but it's possible you can give it to others. So again, we all still need to be safe, even though we ourselves, as if you've had COVID, that you may have some immunity, you still possibly could give it to others.
Thank you. And of course, another vaccine question. I think we could probably do a Q&A on just those. But
Absolutely.
Do we yet know how long the vaccine for COVID will last?
Again, they're still doing a lot of research on this. And as we move forward with further research as well as the vaccine in the general population, we'll know better. We're learning something new every day, and the vaccines research so far is showing this efficacy for this vaccine is very good.
Awesome. Thank you. If you live in St. Clair County but have a mailing address from outside the county, how are these counted? I have 2 immediate family members who have tested positive and were called by the Clinton County Health Department. We told them we lived in St. Clair County but had a Trenton address. They said they would forward it to St. Clair County, but neither has ever been contacted again, and it's been a week.
Again, the test results and the individuals, what we count on a daily basis is if you're actually living in the St. Clair County. We understand that there's some addresses that may be Collinsville, which, and those borderline, the Trenton ones, which are borderline. So we verify by county. Apologize you haven't been contacted yet. Again, sometimes it goes to Clinton County, then it's got to come back to St. Clair County, and those, again, take a few days to get that information. But we specifically go by what county you live in, knowing that you may have an address like Trenton that may be considered Clinton County. And we just do the same thing with Eastside Health District. St. Clair County has 2 health departments, and Eastside Health District is governed by 4 townships, and St. Clair County is the other outer 18 townships. So we go by your residents.
Very good, thank you. Kind of back to another question we answered just a little bit ago. Can you get COVID twice?
It is possible to get COVID twice. Again, it depends on your own body, your own comorbidities, but it is possible to get the illness twice.
Okay, thank you. I know an older person who was COVID positive and sick enough to get to go to the hospital. They were out of rooms and beds, so they placed her in a small holding room with another patient who was there for heart issues, not COVID. They were together in a small area for over 5 hours. Was this a smart idea on behalf of this local hospital?
Again, I don't know this particular situation, but those that are COVID positive need to be isolated for sure. It goes to show that there's a need for us all to make sure we're not overcrowding the hospital by continuing to spread the disease, that we have overcrowded situations. Again, I don't know this particular situation, but COVID positive patients are required to be isolated by themselves.
Okay, thank you. The next person wrote, why is it okay for some doctors' offices to see over 200 patients per day with no way to social distance, and for certain hospitals in the area to continue elective surgery, taking away beds and staff from COVID patients?
Again, doctors' offices and the medical providers obviously need to be seeing patients. They should be wearing their proper PPE as well as gloves and so forth. As far as the hospitals, it is their determination if they want to continue elective surgeries and how they handle each of their beds. And not only the beds, but they need the staffing to provide those services to their individuals. So it's on a flux every day of how many patients are in a hospital, how many beds are available for COVID. Elective surgeries may be just elective surgery that there's no overnight stays. Those are probably easier to handle regardless, but it's up to each hospital and what they can handle.
Okay, thank you. Is any county in Region 4 one of the 50 counties in Illinois that are supposed to receive the vaccine first?
Region 4, we will be receiving some vaccine for our hospitals. They are looking at this on a regional level with 11 regions in the state of Illinois. Region 4 will be receiving some of the vaccine.
And St. Clair County was specifically mentioned. I think they had the top 50 counties with the highest mortality rate.
Yes.
4 counties, I believe, in our region qualify, and we are one of those.
Yes, unfortunately, our high mortality rate is one of the things that they use to determine who receives that. And as we reported today, 263 deaths in St. Clair County is very high.
Which is almost, 100 per 100,000
Yes,
deaths? So
exactly.
that's
Very good.
pretty high. The next person wrote, is it possible that the numbers have been going down this week as a result of the schools being closed for Thanksgiving?
Not necessarily. It's hard. Again, it's across the board with ages and where people are at. We may not be seeing the full effect of Thanksgiving and the impact of that yet. Typically, it's a week to 10 days or 2 weeks after the holiday that we really see the influx. So our numbers have not been going down. It's been over 200 for several weeks now, and that is not low.
Right, and people shouldn't be confused either with that because the daily county positivity rate is going down means that there's a lower rate of infection. It could be that we just tested a lot more people, but if you look at those numbers have been consistently high,
They have.
the positives, the new positives.
Absolutely. Thank you.
Thank you. Will it be safe to send our kids to school in January?
I hope so. Again, we were trying to do everything we can to protect our children and follow the 3 W's, but right now we need to make sure that people follow the rules, both in school and at home and out and about in the public, and especially with the holidays coming. Please be safe.
Thank you. I have been hearing about the vaccine and that it has went through the human testing. My question is, was it tried on older people that have multiple health issues in the studies?
Yes, the studies have covered several different age groups with different comorbidities. Again, as we said earlier, the long-term care, the senior residents in long-term care facilities, as well as the medical providers, will be part of the phase 1A of those that will be receiving the vaccination first.
Okay, thank you. The next person wrote, there are some restaurants that still have inside dining. What is being done to enforce the restrictions? There are a couple in Mascoutah and New Baden.
Again, as I said earlier, we're following up with all the complaints we get. And one thing I want to add with that, as well as our staff following up and educating the individuals, and again, we don't want to be punitive, but we have to protect the public's health. And each time we receive a complaint, we also forward that information via email to the mayor, who typically is the liquor commissioner, as well as the chairman if it's in the county, as well as the law enforcement for that municipality and the county as well, because we're all in this together. We all have the ability to do the enforcement for on the local level with each of these violations, and we'll continue to follow up with them.
Okay, thank you. We kind of talked a little bit about this earlier. If you've had COVID, how long do you have the antibodies for it, and how long will it show up in an antibody test?
Again, that's a good question. There's still a lot of research going on. Right now, at this point in time, they're saying about 3 months. There's different research that says it may be longer, but we'll know more as time goes on.
I agree, a lot changing this year. Daily viewer and extremely thankful for everything you do. I'm in the late stages of pregnancy, and I'm concerned about overcrowding at the hospitals and how it might affect my delivery. Is there any information you could share that might ease my concerns?
Absolutely, and you're very correct. I mean, you're obviously at higher risk. Please make sure you protect yourself and do everything you can to follow those 3 W's, to follow the doctor's orders and get the vaccinations that he would recommend for you during this time to protect both yourself and your baby. There are several guidelines that are available both on the cdc.gov website as well as Illinois Department of Public Health website. One other thing we can add is that when you do, don't wait to go to the hospital. Call them, let them know you're coming, let them know you're pregnant, and they will be prepared to have, obviously, you set up in a place that can protect you and your baby as well.
Okay, thank you. And last question for you, Director Holt, is why are patios such as Bella Milano and The Edge considered outdoor dining? I thought 2 sides have to be open with fresh air circulating. Neither have that.
Again, those are the rules. 2 sides of the tent need to be up, and we can follow up with those facilities too. If they're not following those guidelines, we'll ensure that they are notified and following procedures as they should be.
Okay, thank you very much. Chairman Kern, a couple questions that came in for you. I'm sorry, just one actually. Do we know what the next level will need to be at before the next step of mitigations where non-essentials close again? Hope we don't get there, but just curious since it seems we have more than passed where we were before when it happened. Thank you, Team St. Clair, and they hashtagged wear your mask, wash your hands, and watch your distance.
So the mitigations come from Illinois Department of Public Health working with the medical community to decide, what changes that are occurring that could take place that will affect and help those numbers go down. The mitigation stage that we're in right now really has most of the things closed that cause the spike in this virus. So I don't necessarily foresee us moving into a stricter mitigation at this time. But, there's a chance that if the numbers continue to grow and if we would get, well above that 20% level, I could see, and it would probably have to be statewide since this last mitigation was done statewide, then there could be additional changes. But at this time, I think now with the vaccine rolling out to where the healthcare workers and people in congregate living facilities are pretty likely to be getting this vaccine starting this month. Into next month, they should have the immunities built up. It seems to me that although the light at the end of the tunnel is kind of far away, we're seeing it, and that's the big part. We believe that we'll probably have vaccine. I think Barb has said this, that by the second quarter of the year, we should be vaccinating the general population, and we should really be in full attack mode against this virus. And at that point, then we move back into what is it. The only reason it's called a new normal is because our new normal might include a vaccine every year. It just depends on how strong these vaccines are and how they affect our immune system. But I think we can deal with that. We deal with a flu shot, and so we can deal with that part. And if that's really the only new part of normal, I'm okay with it. I think getting back to where we were before is what all our goal is. And certainly, our hearts go out to the business community that are being affected by this. The bars and the restaurants specifically have been hit terribly, but most of the bars and restaurants are complying. It's really not fair that some try to cheat. They keep our numbers high, and that's a problem. So having everyone comply with the executive order helps us all to move into another phase much more quickly.
Okay, thank you, Chairman. Director Simmons, a few comments here that came in. A big shout out to the Health Department, St. Clair County EMA, and all that work behind the scenes. Thank you from myself and all of us that appreciate your time and concern. The next person wrote, a recent visit to Fletcher's, I was really surprised to see at least 12 tables filled with customers, tables closer than 6 feet, garage doors closed, and the room had at least 48 or more people. I was quite amazed that arrangement meets guidelines. And then the third one is not much of a question, but thank you to the Health Department for finally taking steps against the restaurants and bars not in compliance. Hoping the rest will receive the repercussions soon, as tonight, Saturday, this was when that was submitted, Fairview Inn was once again busting at the seams. Thank you to Mark, the Health Department, and all of you for your hard work. Team St. Clair.
Well, I think Barb kind of covered the businesses who continue to defy the mitigation requirements, and I know we get calls every day and forward on over to her office, and I'm sure they'll address those. As the chairman said, if everybody could just work together, we could get this thing put behind us a lot quicker. I do want to take just one moment. There was a comment that was made on the page last night that was very disturbing to a lot of the followers. Gentleman who had been listed as a death, 80 years old. There was some insensitive people making comments on there about how the average life expectancy of a male is 76 years old. A lot of people take offense to that. We shouldn't be worried about the age. What happened is a family member, also a member of Team St. Clair, was on there. Very disturbing comments. So I just ask that everybody use a little compassion and respect. You never know who's on the page. We will not tolerate any disrespect like that. We have to be able to show compassion for one another during this pandemic time. I don't care if you don't believe in it, but there are people that do. There are people who have lost loved ones, people who have had family members sick, end up in the hospital on ventilators. If you aren't one of them, good. You're blessed, believe me. There have been a lot of people who haven't been. So please, going forward, just remember there are people on there monitoring this page and using it to try to get the latest information. And we apologize to that family member for the rude comments that was made. We'll be back tomorrow with day 269 with the next set of numbers. Thank you.
On behalf of the O'Fallon, Shiloh, and Greater Belleville Chambers of Commerce, we ask you to wear your mask, wash your hands, and watch your distance. By doing these 3 simple things, you will be supporting our businesses, all who have had a difficult year, and they need your support now more than ever. The business community understands the risk to our customers, and we want to present them with the safest environment possible. Whether you are able to shop in store, order online, dine outside, order to go, or call for curbside pickup, it is time we all come together. Together, we will stand strong.